Comedian Bob Saget's death from an accidental hit to the head has doctors reminding everyone on why any type of head injury needs to be taken seriously. With more on the symptoms and why ignoring head injuries can be dangerous is North Shore neurologist and pain management expert with the Avila Health Network, Dr. Chad Demeng. Thank you so much for joining us.
Thank you. Good afternoon. Good to see everybody.
Why can any type of injury to the head be potentially deadly?
So I think most of us are very familiar with concussions. NFL, bruise to the brain, lose consciousness. But when you talk about a deadly head injury, especially in a Bob Saget situation, you're talking about a brain bleed. So I have a brain here. There is a membrane over the brain called the dura. And so if you have a trauma, you can have a bleed outside the dura, which is an epidural hematoma. You can have it underneath the dura, which is a subdural, or you can have it inside the brain, which is subarachnoid. Long story short, the problem is our brain is held in place by our skull. So as this blood accumulates, it's a mass occupying lesion. So the brain is being pushed against the skull, is being pushed downwards. And as that brain is shifting, it can lead to neurological issues, loss of consciousness, seizures, and as the Bob Saget situation, it could lead to death.
What type of injuries would you experience that you shouldn't ignore and go to a hospital if you've suffered any type of head injury?
So epidural hematoma is usually younger patients. So people, sports athletes, they get hit on the temporal portion of their brain and they can have this bleed. What's interesting about an epidural is you can be totally normal for several hours and all of a sudden as the blood starts to accumulate, you lose consciousness and major problems. A subarachnoid, which is inside the brain, is usually bad trauma, people with aneurysms. You usually know it. It's a bad headache, you can't move your neck, and it's a immediate type thing. The one that most people that need to be aware of is subdural. It's usually elderly patients, people on blood thinners, and it can be a very slow bleed. So I've seen patients present with dementia, and they don't have dementia. They had a bleed that slowly built over months. These are, veins that can rip. And it doesn't require significant head trauma because as we get older, our brain starts to shrink. So we have all this extra room in our skull. So as that brain shifts, it can tear these vessels and cause small bleed that builds up over time.
And finally, what type of treatments can you do immediately if someone comes to an ER or a doctor and long term to help with those injuries?
So the first thing is you need to understand what type of bleed it is. So we're talking MRIs, CAT scans, so forth. You need to be very vigilant about monitoring the loved one that has this because, again, they can rapidly deteriorate. When it comes to treatment, the biggest question that we deal with is to evacuate or not to evacuate. And what I mean by that is, do you drill a burr hole? Do you take portion of the skull out? Because as that pressure starts to build, you don't want the brain to move. You don't always have to get imaging immediately. But what you really have to do, and I dealt with this with my mother when she had her brain injury, you have to stay on top of them because if they start to deteriorate very fast, lose consciousness, vision, so forth, you need to do immediate scanning, and that's when you need to evacuate because once that brain is damaged, you miss the window that you can fix things.
Yeah, but most importantly, just don't ignore these symptoms and think it's nothing and get to a doctor or a hospital as soon as possible because it's such a fragile part of our anatomy.
Yeah, look, as a father and obviously with my mother, what do I do, right? I mean, if my child hits his head or he's sleepy, headache, I immediately would take him to an ER, get a CAT scan because my opinion is always to err on the side of safety,
Right.
just make sure it's not a bleed because, again, as we see with Bob Saget, this can have devastating end results if you don't treat it soon enough.
Thank you so much, Dr. Chad. Some really good tips today.
All right, absolutely. Always good to see you guys. Take care.